Hello everybody, my name is Dr. Vijay Agarwal. I'm one of the medical oncologists at Aster CMI Hospital. We are here to talk about lung cancer, giving life a second chance, essentially on the World No Tobacco Day. In terms of lung cancer is one of the most common cancers that we see in our practice. In fact, more than 10% of all the cancers that walk into our clinic are lung cancers. We expect in India over 1 lakh people to develop lung cancer over the next 5 years. So this is a significant burden to our patients as well as to the society in terms of dealing with the patients who do develop lung cancer. There are basically two types of lung cancers. One is called as a small cell lung cancer, the other one is called as a non-small cell lung cancer. For small cell lung cancer is seen exclusively in smokers. Essentially, more than 90% of the patients who develop small cell lung cancer are smokers. As far as the non-small cell lung cancer goes, there are again various types of non-small cell cancers that happen either because of smoking or because of certain genetic insults in the body. Smoking is one of the most important risk factors that causes lung cancer. When we talk about risk factors are essentially something that when increased exposure to patients may develop a particular disease. It does not mean that if you have a risk factor, you will definitely develop a disease, but the chances are more. Smoking is one of those risk factors. So once someone is a smoker, it does not mean that they will definitely develop a lung cancer, but the chances of developing lung cancer is 20% higher in smokers than in non-smokers. Smoking can be of various types, such as cigarettes, pipes, or cigars. In fact, consumption of tobacco in any form or smoking in any form can result in lung cancer developing. It is not just about direct smoke, but secondhand smoke is also responsible for a significant number of lung cancers that we see in our clinic. Apart from tobacco and smoking, other causes are exposure to asbestos, arsenic, or tar at workplaces. If someone has a strong family history of lung cancer, they are more likely to develop lung cancer as opposed to those who don't have a family history. In fact, people with a family history have twice the risk of developing lung cancer. Certain infections, such as infections with HIV, can increase one's risk of developing lung cancer. If someone has certain symptoms suggestive of lung cancer, such as cough, or blood in sputum, or shortness of breath, or aches and pains all over the body, that does not go away with simple medications, I think they do need to be evaluated for lung cancer. There are various tests that one undergoes when someone is suspected of having lung cancer, such as a chest X-ray. And if the X-ray is suggestive that there may be a mass in the lung, then further advanced investigations, such as a CT scan or a PET CT scan, is generally indicated. Patients may occasionally need a bronchoscopy or a biopsy of the mass to confirm that this is cancer. And if it does confirm that it is cancer, then we need to then subsequently know what type of lung cancer it is, whether it is a small cell lung cancer or a non-small cell lung cancer. And if it's a non-small cell lung cancer, whether it is a squamous non-small cell or an adenocarcinoma variety, because all of them are treated differently. Once the diagnosis of lung cancer is confirmed, that is when we start looking at certain treatments to treat. Treatment of lung cancer depends upon the stage of lung cancer. If the patient has an early stage lung cancer, such as a stage 1 or 2, then surgery generally forms the mainstay of treatment. And after surgery, certain patients may also need chemotherapy or targeted therapy depending upon the situation and the molecular characteristics of the cancers. In stage 3 lung cancer, the mainstay of the treatment could be surgery or radiation or chemotherapy or a combination of all of these things. And in stage 4 lung cancer, surgery and radiation have very little role to play, and they're generally managed with chemotherapy. Now we have increased exposure to newer treatments such as targeted therapy and immunotherapy. So all patients who develop stage 4 lung cancers, particularly adenocarcinoma variant, tend to undergo molecular testing to see if there are any targets identified which can be targeted with newer medications depending upon the target. So targeted therapy and immunotherapy has now playing an increasing role in treatment of lung cancer, thereby transforming the outcome of lung cancer patients across the world. However, prevention is better than cure, so one should probably avoid smoking completely, or if someone is a smoker, then quitting smoking probably provides the best safeguard from cancer prevention. In fact, if someone has quit smoking for over 10 years, then the risk of lung cancer drops by about 50%. If someone is a smoker and of age of between 55 and 80 and have more than 30 pack years of smoking history and is otherwise good health, should undergo low dose CT scan screening to identify those cancers earlier on, so that the chances of cure can be higher in those patients if we are able to identify cancers earlier on. If possible, prevention is better than cure. Like I said, stopping smoking is probably the best safeguard. Short of that, having an early suspicion of developing cancer and presenting to your doctor earlier on is the next best important thing. However, the lung cancer treatment has now changed in the recent past, and hopefully with newer medications coming through, we can hopefully make lung cancer a chronic disease. Thank you.